Well, I'm Dr. Randy Goldstein, and I'm excited to introduce a friend and a colleague, Dr. Carlos Fierro, who's here today, and we're going to be talking about the flu immunization amidst the COVID pandemic. Good morning, Dr. Fierro.
Good morning, Randy. So happy to be part of this.
Thank you. Why don't you tell us a little bit about yourself, and then we'll get started.
Okay, you bet. I'm Carlos Fierro. I'm the principal investigator at Johnson County Clin Trials here in Lenex, Kansas. Currently, we are working on a couple of the different COVID trials. That means we are testing vaccines that hopefully will help us see our way out of this pandemic.
Great. It's an exciting adventure, and unfortunately, we're having to go through it. Well, let's get started. My first question is, with the flu season coming, do you foresee anything different with the influenza now that the pandemic is here compared to previous years?
You know, that's a great question. It's difficult to predict what the flu is going to do in any given year, and especially this year. On the one hand, we've all been taking precautions, wearing masks, social distancing, some activities that we normally do together in which we congregate are curtailed or canceled. And so that may have an effect on the flu in the direction of less flu. On the other hand, as we experienced a few years ago with the H1N1 flu, there could be an epidemic, just like we're experiencing with COVID. COVID is a special type of epidemic, global pandemic, but we can experience epidemics here in this country with flu. And so it's really impossible to say. However, given the say gravity of the potential negative synergy that could occur with combined COVID and flu, we really need to assume that we'll have a significant flu season and prepare for it.
So having said that, more important this year, even more than in previous years, to get the vaccine, the influenza vaccine?
Absolutely. A small downside to getting out, taking the time, experience whatever minor side effects there may be from receiving the flu, to a potential huge upside, and that's preventing that calamity that could ensue with a combined COVID and flu outbreak especially in our area, in a metropolitan urban setting.
Yeah, I think having people get sick with the flu and COVID at the same time fills up the hospitals, and that's what causes the dilemmas.
Exactly. On the one hand, on a sort of a population level, worst thing that could happen, that in the middle of a situation where you're filling up your hospital's intensive care units with one condition, and then suddenly realize that you have a need to use many of those resources, many of those beds for yet another condition. On an individual basis, people who have chronic disease or weakened immune systems, if they're susceptible to getting the flu, they're probably also susceptible to getting the coronavirus and not doing well. And so in those instances in which somebody's weakened immune system has to deal with both conditions at once, it really could just be overwhelming. And so
Okay.
for those reasons,
Oh, I'm
yes.
sorry.
No,
I'm
go ahead.
asked all the time, does the flu shot give me the flu? Or people that don't want to get the flu vaccine because they say the last time they got it, it made them sick. Can you comment on that for just a minute?
You know, this is something that I've encountered frequently in my role as a vaccine investigator. And it may have been a legitimate concern in the past in which live virus was actually used as vaccine. Nowadays, that's rare. If a live virus is used, it's greatly attenuated, meaning it's really weakened to the point that it's not going to make you sick. It's not going to give you the disease that it normally gives out in nature. And especially in the case of currently of most flu vaccines, certainly in the coronavirus vaccines that we're working on, there's really no way that the vaccines can give you the disease. You're not going to get the flu from a flu vaccine. You're not going to get COVID from a COVID vaccine. What may happen, though, is that the vaccine does what it's intended to do, and that's to arouse an immune response. And many times that awakening of your immune system is not without physical noticeable consequences. And so, many folks may have a little bit of a fever, achiness, muscle aches, fatigue. And what is that telling us? Hey, your body is reacting. It's developing the antibody that we want your body to develop after we get vaccine.
Yeah, that's what we want. That's why we got the immunization.
That's what we want. And it brings to mind this concept that maybe some of your viewers are familiar with, and that's that sometimes for some gain there may be a little bit of pain. Consider when you're working out, those of you that are up on the parallel bars or what have you, doing pull-ups and doing these amazing gymnastic moves. You're training for that. At the end of the day, how do your muscles feel? They're a little achy, and you're tired, but you know that it's worth it. It's a signal to you that you've had a pretty good workout and that you're getting the effects that you want, that you're looking for. In the same vein, when we give a vaccine and a person develops a little bit of reactogenicity, hey, we wish we could do it with zero reactogenicity, but it's well worth the discomfort to be protected.
It's your immune system getting a workout and getting prepared for a fight.
Absolutely. Perfect way to put it. The immune system, you're beefing it up, getting it ready. Should this virus enter your body, to thwart it quickly.
Well, that's great. So really no excuse this year, especially with the COVID pandemic and influenza nearing, no excuse to not go out and get your influenza vaccine and continue what the CDC is recommending for COVID precautions. Any last thoughts, Dr. Fierro?
I fully agree with what you just said. I would say that for individual protection, no doubt we should be getting the flu vaccine, not just to protect against a tragic outcome that we all know can happen in the case of flu or COVID, but also let's remember that we receive vaccines to be a team player, to protect ourselves, but also our families, our community, the people we love, the institutions that are important to us. And in this case, we're all, when we get vaccinated, doing our part to prevent overloading the local healthcare system. And so, yes, fully agree with your recommendation that, or your observance that no excuse to not get vaccinated this year.
Well, I have to say you are a great friend, also a colleague, and a bit humble. You're a genius. So I wish you the best of luck in helping the CDC and the world find a cure to COVID. And I certainly appreciate your time this morning in talking to us a little bit about influenza. Carlos, stay safe.
Thank you. Ditto. Good talking to you, Randy.
Talk to
Take
you
care.
soon.